Hi dear all. Today I'm sharing a video on Turner syndrome. The incidence of Turner syndrome is 1 in 3000. It occurs because of the absence of one of the X chromosome. So there will be 45X, or we can call it 45X0. In the child which have 45X0, maximum undergo the spontaneous abortion, and the few who survive will present with the Turner syndrome. And sometimes there is mosaicism. So there may be presentation with the 45XX and 45X. As we know, usually we have 46 chromosome, but there may occur aneuploidy and there may be deletion of one of the chromosome. So in that, 45X presents as the Turner syndrome. At birth, Turner syndrome may present in the form of the lymphedema of the hands and feet. Also, there may be loose skin fold present at the nape of the neck. Other features of the Turner syndrome include the short stretcher, short webbed neck. There may be low posterior hairline. Anomalous ears may be present. Narrow, high arch palate will be there. There will be apicanthal fold, drooping of eyelid in the form of ptosis, shield-like chest which is characteristic with hypoplastic nipples, and they have increased carrying angle at the elbow. Medial tibial exostosis is present. There will be short fourth metacarpal and metatarsal, and also the presence with the delayed puberty. Now, how to manage a child with the Turner syndrome? The basic problem the child comes with is short stretcher. So we will use a growth chart to evaluate the child. Once we diagnose the child with a short stature, if the child and parents are affording, we can go for the growth hormone replacement. And with the help of the growth hormone replacement, we can have an increment of 8 to 10 centimeter in the height. But usually the adult height is less than 145 centimeter. And because of this short stature, the child may have some behavioral problems. The child may have ADHD, child may have depression, all that can occur because of the severe short stature. Another thing we can have is delayed puberty. As we know, in Turner syndrome, the ovaries are streak ovaries, and there are low levels of the estrogen and progesterone. So there is delayed puberty, amenorrhea, sterility present. So due to that low estrogen and progesterone production at the ovaries, there may be elevation of the LH and FSH. So there occurs hypergonadotropic hypogonadism. And for that, we need to do the ovarian hormone replacement. So we will use the conjugated estrogen. Also, after that, we can switch to the cyclical therapy with the help of the estrogen and progesterone. Suppose if in the gonads, such as streak ovaries, there is presence of the Y chromosome, the child is at the risk of gonadoblastoma. For that, we need to do the gonadectomy. Other features which occur and need evaluation in the child with Turner syndrome are horseshoe-shaped kidney may be present, or the pelvis of the kidney may have a cleft. So for that, we need to do the ultrasonography and renal evaluation of the child. There may be coarctation of aorta. So for that, we need the cardiac evaluation. Also, there are perceptive hearing defects which occurs in the Turner. For that, we need to make the child undergo regular audiometry. Also, 15 to 30% of the children with Turner have thyroid evaluation. So this is how we are going to manage the child with the Turner syndrome.